So first of all, welcome. The topic that we're discussing really is a very broad topic and multifaceted, mental health. We have a series of 4 panels that are exploring that from different angles. First of all, I'd just like to thank our main sponsors of this event, which are Corderai Partners and Convergence Partners, Corderai Ventures and Convergence Partners, both of whose GPs are actually here. In addition, the event is in collaboration with the IMD Business School and the European Brain Foundation out of Brussels. Dan, would you just like to say a few words about the event? Thanks so much.
Guys, first of all, I want to say thank you for filling this room up. This really shows us how important this topic is, really, and really appreciating your interest in this. So some ideas, some thinking basically behind putting these panels together. So mental health is a very complex issue. It's possibly the largest epidemic or crisis our generation is experiencing. And what we were trying to do is putting together a series of panels with representatives from academia, startups, research, and also corporates to really give you all kinds of different angles and inputs, raising awareness on the challenges that we are facing, but also outlining some of the solutions that are out there actually, that are lined up actually to help solve this crisis. So the first panel will talk about really some of the research being done, some of the initiatives in Brussels that are currently being worked on, and then we're moving into, and also obviously some investment trends that we are seeing as representatives from 2 VCs. We're then moving into executive mental health, employee mental health, obviously very relevant also to this audience, to really see how can we increase stress resilience, how can we increase empathy of leaders, how can we decrease stress levels at work. We're then moving in panel 3 into a series of startups that are developing super exciting solutions, different facets, again, of tackling this problem, different modalities that can be combined to enable truly personalized mental health care. And in the 4th panel, we are launching the Aquila Kondo Foundation, which is looking to bridge ancient sacred wisdom from indigenous communities with the research we are doing here in the Western world into consciousness, into mental health, and the idea is really to combine this and elevate the human consciousness to a next level. So I hope you enjoy our panels and discussions, and very keen to talk to you afterwards as well and answer any questions.
Thanks, Dan. Just to point out, the panel conversations are only about 30 minutes each, and obviously they're very broad topics. So we're going to try to be as precise as possible with the panelists as well. Before we start, actually, I'd just like to ask a question. I'm going to stand up for that one. So the first panel actually is on, basically innovation trends in the mental health space. I'd just like to ask a question first of all, when thinking about innovation in the mental health space to the audience, and that's basically, have any of you or anyone that you're close to benefited in the last 2 or 3 years from what you would consider innovation coming from the mental health space? That could be care, self-care, it could be digital health, digital therapeutics, telehealth, plant medicine, So there's a good showing of hands. Let's show some more confidence, maybe some apps out there, meditation apps. Think about innovation. More hands going up. Yeah. Thanks very much. I think that's it's interesting just to take that perspective in the last few years. Had we been here 10 years ago and we asked the same question, what would have been the response? The second thing I think about that response actually is probably one of the most important aspects of what we're doing in society regarding mental health, and that's destigmatizing actually the topic itself. And not only destigmatizing the topic, but reframing the topic actually in the context of a social value and even potentially a social strength. So with that, we'll jump into the first topic, which is emerging trends in the innovation space. And before I do that, I'd just like to have the panelists themselves, if you could maybe just introduce yourselves and say a little bit about your work and interest in the space in particular, before we drop in. Dan, you want to?
Sure. So I'm representing Convergence Partners today. We are a Swiss VC firm focusing on healthcare areas with large unmet needs, where we can make a huge social impact with our investments. So 2 key investment focus areas for us have been women's health and mental and brain health. And I would say together with Kodori, we've done a number of mental and brain health related investments over the last years, and consider this as one of the most interesting spaces to engage in. And I think we'll outline later why that is. But we're also in the process of launching a dedicated brain health fund, and very keen to work with institutions and foundations to support us with this.
Great, thanks, Dan. Olaf, would you?
Yeah, hi, my name is Olaf Blanke. I'm from the EPFL, the Swiss Federal Institute of Technology. I'm a neuroscientist by training and mostly work in the field of neurotechnology. Very much on the basic science side, but I originally started as an MD, so very interested in translating some of our findings to the clinic, and have been involved in three startups. Thrilled to be here. Great crowd.
Frederick.
Good afternoon, good evening. My name is Fred Destrebeck. I'm the Executive Director of the European Brain Council and the European Brain Foundation. So the EBC, we are a multi-stakeholder platform advocating for public investments into neuroscience and brain research. And in conducting that work, we have done quite a few studies on the societal impact of brain diseases, but also the benefit of improving care pathways for people living with a brain condition. So our work really revolves around brain health and brain innovation. And as I said, we also set up a European Brain Foundation to really expand our activity in our remit and the expertise of our membership in order to leverage more funding into the space.
Thanks, Frederick. Good to have you here.
Thank you.
Alex?
Hi, everyone. Yeah, thanks for coming out to really talk about probably the most prescient and important topic that I think we could find represented at Davos on a real societal level. It's my opinion, obviously, but that's also, put my money where my mouth is. And what I do is I work with a private investment company called Kodori Ventures. We invest into early stage mental health innovators that could occurs in both the digital therapeutic space, psychedelic space, as well as the precision neuropsychiatry space, really where people are moving the needle in terms of the innovation that will define a different paradigm of mental health.
Maybe Frederick, to kick us off, given your role as the Executive Director of the European Brain Council and Foundation, perhaps you could just make a few comments and observations from your perspective of what are some of the factors that are giving rise to some of the growing issues and concerns regarding mental health in society.
Well, the first thing I wanted to say is that the conversation could not be more timely, as yesterday was Blue Monday. So we all know what it means, and we probably all experience that one day in the year is probably a little bit more difficult or more challenging. But from the perspective of EBC, we conducted a series of studies. A couple of years ago, we estimated that 1 in 3 Europeans was likely to live through a brain disorder within their life course. So that means either a neurological or mental condition, but with time we found that this was severely underestimated. There were more recent studies being made by some of our member societies, like the European Academy of Neurology, suggesting that in neurology alone it would be 2 Europeans in 3 living with a neurological condition. So lately what we heard from some of our mental health member organizations was that we estimate that every European or every person would have experienced suicidal thoughts in the course of their life. In recent statements in launching the initiative and action, the European Commission said that post-COVID, 1 in 2 Europeans was experiencing depression and anxiety. So I'd say that regardless of the exact figure, what we can say, and to the example of the question you asked earlier, it's touching every one of us. It's a major burden. Personally, it's a major burden for us as relative to someone living such episodes, but it's also a burden to society and a burden to our economies. So there is definitely a need for action. There is definitely a crisis that we need to attack and to address. But I also need to finish off by saying that in order to give the full picture, we also need to have a careful look at the health determinants, and particularly the everything that relates to socioeconomic disparities that we really realize are a #1 risk factor. It relates to education, it relates to housing, it relates to social exclusion. And there is definitely there something that we need to tackle. Otherwise, all the discussions that we would have in the context of Davos or back in Brussels or back or to wherever we work would be pointless, because it would mean that every one of us would be like Sisyphus, repeating all over a desperate cause and fail. So there is definitely a need to have this holistic approach when we
In addition to the socioeconomic disparity, what other sort of core driving factors do you see as influencing the growing issues and crisis from a mental health perspective?
Well, as I said, socioeconomic factors primarily. I was earlier in another discussion where we mentioned education. As I said, social exclusion, but housing has been proven in the country I know best to be a number one risk factor for deprived populations. And I would probably comment also, because we're here during the World Economic Forum, that if any one of us would bump into world leaders, there is really a source of concern to me these days is the tendency that in facing the global instability that we live in at the moment, there would be this tendency to retract, to probably go back to austerity measures, like we've known it in a couple of years ago. And that's probably a number one risk to all the discussions that we are having, and the need for more proactive investment and proactive initiatives in the space, whether in mental health or any other areas, and particularly in health matters.
Yeah, thanks, Frederick. Olaf, can you give your perspective from the fields of sort of academia and applied science on the same thing, and really how in that perspective, how are you guys sort of perceiving some of the challenges and also some of the innovations to address some of those challenges?
Yeah, sure. So this is a great time actually to give an update on what happened to neuroscience over the last decade. There has been an influx, an explosion of new methods, but also new devices that have come from engineering into the neurosciences. So actually, in academia, you can't even speak about neuroscience anymore. It's more like neurotechnology and all the boundaries that have been across academic areas like neuroscience, engineering, medicine, and of course computer science. They do not really exist anymore. They don't make sense. And I think it's very good, because we desperately need advances for many of the diseases that were just mentioned, for which we don't have a cure, we don't have good therapies. Some of the therapies were developed in the 60s. They're they're efficient treatments still today. They're mostly used in psychiatry, but they have many side effects. And again, they were developed in the 60s. So one thing I wanted to say here is that if we want to understand mental symptoms, if we want to understand cognitive symptoms or disorders, we somehow have to bring them to the research lab. We should be able to test them in us, in mini versions, because we all have this potential in us to at some point react in this way. So if you want to understand and come up with treatments for depression or for hallucinations, you have to induce it and study it in healthy subjects in the lab. So like we discussed before, you could say, well, psychedelics can do just that. But I think, and work that we've done at EPFL is that actually technological advances in neurotechnology can be even used without pharmaceutical approach, or they can be combined. So this is something like technodelics that we're still looking for better names, but I think it's something that could be quite catchy, where you use virtual reality, robotics, brain stimulation, haptics, and combine those with the standard neuroscience techniques in order to induce very fine-grained mental states that are like depression, that are like hallucinations, specific hallucinations in our case. And so that's a big difference compared to psychedelics, where if you'd give a typical dose, you would be in a psychedelic state for several hours maybe. So you can't, or as a researcher, I couldn't do experiments. Of course, I can map the brain activity, but I can't test many things and do control conditions, and no worries, I won't go into stats and all this stuff. But that's a necessity that we need to have a good model. So what we're really lacking is a good model. And I think if we want to understand mental states, we have to be able to induce them in me, in you, in Dan, and all of us, in mini versions under safe conditions. And so we didn't start with a typical mental disorder to do this. We actually took Parkinson's disease to do this because, believe it or not, it's not just a movement disorder, but 50% of Parkinson patients will suffer from specific hallucinations, extremely specific hallucinations, like seeing a lot of people in a room, like I'm seeing right now. But it comes several times a week or several times a day without a psychiatric underlying deficit. And what we have been able to do is use the technodelic approach that induces this kind of hallucination in healthy subjects in a mild form, but then we saw that a subgroup of patients, about 50% of them, who react very strongly to this. so strongly, 10 times more stronger. So, and those were the patients who also experience them on a daily basis. The advantage is now we can take this, we can do the same measurement, the same technodelic approach 10 years before. So we need to wait until the patient will actually have it and become symptomatic. We can detect it before by measuring the brain, by measuring the sensitivity. And then, of course, for a lot of therapies, also when you go to depression or schizophrenia, you want to start the treatment before it's too late. Whether you're working with elderly subjects, we do, or with teenagers in the case of depression, anxiety, and schizophrenia. So I think the take-home message is technodelics is not just a fancy word. It's testing and working with everybody, with the general population, to find methods to induce the state we're interested in as a model, to develop a model for it and then take it to the clinic. And of course, just one comment, so one startup that I've been involved in uses the technodelic approach outside the clinic. And of course, for well-being, meditation, and contemplative practices, those are all very special experiences. And the same technology can also be used in healthy subjects to allow them, in the case of metaphysics engineering, which is the company, to help and guide to not just treat and understand, but also to induce positive experiences.
Thanks, Olaf. You gave a very good sort of specific area of innovation that's emerging also from your clinic in EPFL. Frederick, obviously in your role, you're trying to orchestrate that value chain, if you like, of collaboration to accelerate innovation. Dan and Alex, how do you view the role of capital in accelerating, that stakeholder value chain in order to accelerate innovation? And and also let me ask a second question onto that. You're both obviously launching and have launched and are managing funds dedicated to this space. What factors are giving rise to that timing for you guys? So I think there's two questions in there: the role of capital, if you like, and what factors are giving rise to this for yourselves.
Well, I'd like to touch on the second, the timing, because I think every single person in this room who's here knows that there's a mental health issue societally. But the kind of changes and the kind of that data-driven approaches that are necessary to really transform this field are finally coming to fruition. This is a fantastic time because people have started to focus on mental health in a serious manner. I think COVID really did a number on a lot of people in terms of changing how they view mental illness, not as something that you push out, and try to hide in some corner. It's something that affects every single one of us. It's as relevant as our physical health on a very daily basis. So the idea of, yes, now is the perfect consternation, the perfect, stars aligning, of people having a serious interest in pursuing mental health changes, frankly, a need to on a societal level, because I don't think it's healthy what younger generations are going through, and I think the downstream effects of that are going to be, potentially disastrous unless we do something now. And I can't think of a better reason why it's a better time to address these issues that have existed for a long time, but have clearly ratcheted it up. So, the time is now to do it.
And maybe, Dan, you want to pick up the second piece in that question? Is like, how do you perceive the role of capital in catalyzing that innovation cycle, right? So we can take some of the research work, through to impact and, at scale in society.
So I guess until a few years ago, there was a one-size-fits-all approach, right, to treating mental health issues. And this basically giving drugs, suppressing the issues, and not actually healing the condition, right? I mean, this is something, that has been used across all patients, so no personalized approach. So what the technology is now enabling is truly personalized approaches and much more efficiency in diagnosing conditions, but also developing a treatment mix of different modalities: pharmacological, talk therapy, digital therapeutics, technodelics, psychedelics, to really develop very personalized treatment programs for patients. And that means especially on the technology side, and also some of the drug developers in the psychedelic space, I mean, this is capital intensive, right? So we are seeing per week probably 10 to 20 new startups working on exciting solutions. However, these guys need money, right? And historically, mental health has not been super sexy for venture capital investors because of this kind of mono approach, right? And this is really changing now. So it's absolutely essential to support these young entrepreneurs and basically have more investors like us that are basically leading investment in this space.
Yes, so what type of areas do you guys sort of look at? What specific areas are you seeing emerging that can have these innovations at scale? That you're looking at in terms of backing initially from a capitalization perspective.
I think a really important one is definitely the psychedelic drug development industry. The current model of you walk into a psychiatrist and you're prescribed SSRIs. I think that's finally coming to an end. But in order to we need to replace that. And psychedelics offer a fantastic, incredibly broad area of potential, chemical alterations that also are curative in some capacity, which is incredibly rare for most drugs. And down the line, they're going to get incredibly precise and they're going to be incredibly, differentiated. But again, that requires a lot of capital for the clinical trials to be run correctly, because I think that's one thing that no one wants to screw up again. And not only for that, but for the drug development and for the drug discovery. I mean, this is all incredibly capital intensive. So that in particular, but I could name every single section of mental health innovation, and I would say that they're still underfunded.
Right. And Dan, for yourself, with Convergence?
Yeah. So I think I would really mention two key problems where like patients are facing. Number one is access to care. Interesting statistic here. So globally, basically for every 100,000 people, there's one mental health therapist, right? It means of approximately 1 billion people that are currently estimated to suffer from mental health issues. Most of them will never see a therapist, right? So really giving people access to care is a key element of our efforts. So there's some really interesting platforms out there. In some cases, AI, machine learning driven, they're getting more and more sophisticated, where patients can basically get access to care within minutes, right? So they don't have to, so for example, in Switzerland, Germany, we have to wait for 6 months until we get an appointment. Here you can actually access care immediately, right? And then also have an online treatment program, personalized to your condition. So this is an area that we are, quite interested in. And also particularly in the B2B space. So when it comes to also working with employees, and again later, and you will hear also of some companies that we brought here that will talk about their solutions and are having enormous positive impact in their organizations. The second area I would like to focus on is really this much more specific diagnostics, right? Using novel biomarkers and also treatment mix of different options using technology. Neuromodulation is one area. TMS has been around for many years. Finally, it's really taken off. Therapists are starting to use it together with therapy. There's constantly new innovation on that front. And in generally also technodelics. I mean, we have some examples here. You can actually test some of this equipment here using a combination of visuals, haptics, sound to get patients in a transpersonal state, right? Disassociate them with their worries and really making them much more effective for talk therapy, right? So really using all these different modalities in an effective manner is something we are very interested in.
Yeah, thanks. As Dan was saying that, Frederick, what comes up for you from a public policy perspective as you begin to hear this sort of catalyzation of capital, right, that can be, begin to accelerate some of the innovations that are coming out from EPFL and things like this?
The reflection I've got is really that we need to create opportunities to generate enabling environments for all the players to be able to interact. That's what we have done at EBC by creating the European Brain Foundation that I mentioned, but also launched the Brain Innovation Days. So these are a couple of days in Brussels where we convene our community, but also investors, start-uppers, anyone interested really into brain innovation. Basically, the next event is 13th, 14th of November. I'll make bit of self-promotion here, but we are now launching ancillary activities. We're discussing with Daniel the launch of a hackathon on this occasion, and we are pretty excited with this. But we are also collaborating with incubators and other pitch competitions. That's, let's say, additional activities that we are now fostering. And I forgot to mention that one of my affiliations was also being a vice chair of PAREA, which stands for the Psychedelic Access and Research European Alliance. And with that remit, EBC is fully supporting the emergence of research and access to psychedelic-based therapies.
From just extending that out on a more perhaps broader perspective, particularly from a public policy perspective now, what is the call to action, do you think, from a public policy perspective? How would you summarize that?
Well, for the moment, we are really working on the a partnership with the European Commission to launch more public investment and to really streamline the effort. Those of you who are familiar with the research policy at EU level would see that it is extremely fragmented. That's probably an understatement. And we are now working with the member states to really have a push and a biggest drive into investing into the space, but also making sure that because we have great research in Europe, we also have probably one of the wealthiest regions in the world, but it's also to bridge the gap of translation to make it accessible to the broader public.
And of course, great from a private capital perspective, right? That we can partner with public capital as well to accelerate that. Olaf, from a research and academic side, what sort of comes up for you as you're hearing that type of conversation now? I mean, obviously, you guys are working at the very sharp end of innovation, and
of course, innovation funding is great. Funding is important. Public funding, private funding, and I think on the European side, I think. Public and private together need to be searched for, need to be enhanced, and new relationships need to be built. And of course, not everything will work, right? You don't know. If you know the solution before, well, if you know how to start a company before to solve these problems, well you don't need to try, right? Then you have the solution, but one needs to keep trying, whether in academia or in a company, to drive the solution to success for mental health, right? How are you going to induce anxiety in a research lab in a fine-grained milligram-based form? How do you do that, right? And how does that is an anxiety that, let's say, you and I will share? How do you do that, right? So it will need a lot of work, a lot of funding, and I think academia and companies, startups need to work closely together. Also, the big companies obviously are more than invited to join this and this endeavor. But we don't have the solution now, and it will need a lot of hard work. And we need to have, I think, a basic science, fundamental neuroscience argument has always been, well, the animal models just don't work, right? How are you going to test depression in a rodent model, right? In a rat or in a mouse? I mean, that's 5 grams of a brain, but those are models we use. So, in a nutshell, we need quantitative, hardcore, good models in humans, in us.
It's also difficult to get self-reporting back from a rodent, right?
Let's work on that. That's the first project we should work on. Yes.
Dan?
Yeah, I mean, just to reiterate, I think the call to action is really to bring in all stakeholders together, right, and effectively, find solutions to this, like the biggest problem we're currently facing in this world, right? And we're really trying to live this here, right? So Olaf is working with us on our advisory board as a research representative alongside a number of other professors. We're working closely with the European Brain Council. We're planning a hackathon where we bring together startups, people from the front line, corporates, investors, to really raise awareness together, develop solutions together. And then obviously, most importantly, we need also the support of the government, right? The right policies, in Brussels, support, funding. We need, our investors, which are institutional investors, they need to be incentivized also to support the space, right? So I think if we all work together, I think we have all the puzzle pieces. We just need to put them together in a nice way.
Yeah, great. Well, that's where the work also of European Brain Council and public policy comes in to help assist that, right? So, thank you very much, gentlemen. It was, we're hard up on time. It was a short one, but I hope the audience also found the conversation useful. Just as a closing comment, I just want to read a line from an author, Tony Bernhard, who wrote just about innovation. I think it's a useful way to kind of maybe frame it and think of it in closing. He wrote, innovation is not just about new technology, but about finding entirely new ways of thinking, and finding radically new approaches to solving what are often old problems. Innovation is not just about making things better, but it's about making things possible. I think that captures the sentiment well. So again, thank you, gentlemen. We'll close, and then I'll hand off to the next panel. So it's a quick relay on this.